So the AFO is responsible for a lot of falling as well.
Yes, because you can't move the tibia. If it's stuck like this with the band here and stuck at the ankle down here, you can't do this.
Mm.
So if I want to maintain my balance, I have to have what we call an ankle synergy. So your tibia has to move forwards and backwards. I have to have a hip synergy where I move at the hip, or I have to have a suspensory synergy, which is you lower your trunk towards your feet, or I have to do a stepping strategy. Well, most people can't do a stepping strategy because you can't bend at the ankle and bend at the knee to take a nice step forward when you're walking.
So what you're telling me is that when most people get fitted for an AFO, they don't go through all of that detail. Somebody just turns up and says, "Give me your leg. Let me take some measurements. Let me cast it, and let me get something back for you." That in that next stage where they get back the first cast of the AFO, for example, is there tweaks? Do they try and fit it anymore, or not? How does it kind of work?
They do. Okay. So I got to preface this. When they're casting, they tend to bend the knee and bend the foot up to get the best range so that the cast can be set in neutral. But when are you walking where is your knee bent at 90 degrees and your ankle is at neutral and your foot is on the ground?
Never.
Never. So that's the first thing. And then the second thing, most people are scanning the foot now. And when I was at Ohio University, I was in the midst of writing a grant, and we were going to do an algorithm for scanning the foot and how to make changes in the CAD CAM model so that the AFO could better fit the foot and we wouldn't have to do all these changes on the back end. If you went through the full process on how an AFO is made, you wouldn't believe why it doesn't fit properly. So now I can get back to the question that was asked. Are there tweaks? Yes. And the number one tweak is you have too much space someplace and not enough the other place, and it rubs. So they tend to rub on the bullion here, and then
Mhm.
the foot goes out like this, and it tends to rub on the lateral part of the ankle on the bone that sticks out there.